Hi again. In the last segment, we looked at ICSUS data and learned more about alcohol use and mental health responses. This information is important on a statewide level as funding decisions are made and as legislators discuss and pass laws that regulate drugs like alcohol, tobacco, and cannabis. So, what does this data mean to you on your campus, and how can you use it to inform your strategies? Remember those from Project AIM? First, data is necessary because it tells an important campus story. Just giving someone numbers about how many students are engaging in binge drinking may not have as much of an impact as showing them how many through data visualization. Numbers are just that, numbers. They don't show the human side of an issue or the impact that those numbers have had on students and the campus community. Use your data to paint a complete picture of what's going on with your students. That student who never engages in any social activities could be too depressed to even leave their room. The student who consistently misses class may be too hungover every day to do anything but sleep. These students are sons, daughters, brothers, and sisters. They aren't just an anonymous number on a survey. Second, data is necessary for you to develop your outcomes. If we don't know what our issue is, we will never be able to solve it or make progress. What's the difference between an outcome and an output? Think about cupcakes. And who doesn't like to think about those? What do cupcakes have to do with outcomes and outputs? What is the outcome of me mixing up the flour, sugar, and butter, choosing the liners, and baking? Is the outcome cupcakes? No. The outcome is that I will be a very happy person as I eat one or three. My happiness and tighter jeans are the outcome. The cupcakes are the output. So, what is the ultimate outcome you hope to achieve, and what will your outputs or strategies be as you work towards that goal? Let data be your guide. Third, data is necessary to inform decision making. There are three aspects to inform decision making and what data you can use at various stages. 1. Real time data analytics, information that is collected and immediately disseminated. 2. Predictive data analytics, historical data collected over long periods of time to inform future choices. 3. Prescriptive analytics. Instead of simply predicting what will happen, prescriptive analysis tweaks certain variables to achieve the best possible outcome and then prescribes that course of action. Let's look at a couple of examples. At Dartmouth College, IT teams use real time data collection and analytic tools to inform instructional design. Through real time analytic applications, teams can study metrics including attrition rates, course enrollment sizes, and student performance to redesign courses based on students' needs. Predictive analytics helps us know what is likely to happen in the future. For example, at the University of Alabama, the use of predictive analytics found that students who asked for copies of their transcripts might be at risk of leaving the university. Now, administrators can note when a student puts in such a request and offer academic and campus resources to encourage those students to stay. Prescriptive analytics helps us to see what can happen now. For example, universities can use an online program to measure a student's engagement with a specific course. As a student's interactions with the program progress, the data is processed and evaluated, and adjustments can be made to the student's learning path to help them be successful. The ICSUS data could be helpful in predicting what might happen in the future with student drinking or mental health. If there has been an increase in the ICSUS data with students reporting that they have had 3 or more days a week when they have felt sad or anxious, you could predict that it is likely that there will be an increase on the next survey. Knowing that is highly likely, you may plan to enhance the services you will provide to students by extending the hours of the counseling center, increasing awareness campaigns about mental health, and providing additional mental wellness activities. The ICSUS data can be useful in helping you see what can happen now on your campus. By developing 10 of your own questions, you can narrow the focus of your strategies and programs to a targeted group to get their feedback. This feedback, through focus groups or interviews, can be invaluable as you adjust and refine the programs, services, and support you offer to your students. Beyond the numbers for alcohol use and mental health, the ICSUS data can also be a valuable tool in identifying at risk students. These can be students who are academically at risk of failing a class or even a semester, and students who are at risk for increased mental health issues because of their substance use. ICSUS is an integral part of your ability to identify students who may need an intervention and referral because of their drinking or because they are in a mental health crisis. You can use your 10 questions to assess if students are using the student health and wellness services. And if so, what feedback do they give you about how accessible they feel services are, how comfortable they feel using services, and if they feel using services have improved their mental wellness? You might be thinking that all of the data is great, but how do you present it in a way that people will pay attention? There are many ways to present data that are much more interesting than handing someone a summary of an ICSUS. Here are some other ways you can talk about your ICSUS data. 1. Infographics is a graphic visual representation of information, data, or knowledge intended to present information quickly and clearly. Here's an example of an infographic. They can improve cognition by utilizing graphics to enhance the human visual system's ability to see patterns and trends. 2. Word clouds. A word cloud is a collection or cluster of words depicted in different sizes. The bigger and bolder the word appears, the more often it's mentioned within a given text and the more important it is. Also known as tag clouds or text clouds, these are ideal ways to pull out the most pertinent parts of textual data or feedback from blog posts to databases. There are free word cloud generators that you can use. Here are two. Any way that you decide to talk about your data, it's important that it is shared with the people who need to hear it. Hopefully, by now, you have built a campus task force or coalition of diverse offices and organizations on campus. This is the first place to share your data because these members are likely the ones working on these issues every day. If you don't have all the decision makers at the table, request individual meetings so you can present the information and encourage them to join your efforts. Linking ICSUS data to student retention, graduation rates, and alumni support can be useful tools when presenting data to your administration. Student leadership and other student groups are also important to include in your data sharing. They can be integral in helping you develop messages and programs that positively impact their peers. Finally, every campus is part of a community, the gown in town gown. If you are not already engaged in your community substance misuse prevention efforts, you should be. Not only is being part of the community coalition a great way for you to educate them about what's happening on your campus, but it can enhance your opportunity for potential funding and other collaboration. By Indiana statute, every county has a prevention coalition that focuses on reducing substance misuse. Each coalition meets on a regular basis, and through funding collected by the court for offender fees, coalitions provide grants to community members that are addressing alcohol, tobacco, other drugs, and mental health. Every coalition has their own grant guidelines, but are likely already implementing strategies that fall under their comprehensive community plan. So, get to know your local coalition and invite them to yours. You might be surprised at the positive impact of the connection and the success that is possible. Thanks for joining us for this micro training series on the ICSUS. We hope that you have been inspired to present or use your data in a different way. And if you aren't a campus that participates in the ICSUS, we hope this motivates you to take part next time. The final training in this 3 training series will focus on Delta 8. We hope you will join us. As a reminder, don't forget to click the link in the video description to take the brief evaluation. Thanks to the Indiana Division of Mental Health and Addiction for providing the support for this training.